Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Garland.
Hey everyone. Today I'm bringing you an episode with two of my favorites. We recorded this episode live during the annual scientific meeting at ACG 2022. The first guest that I have in this episode is Heather Hampel, and she's going to talk to us all about genetic testing and why it's important to identify early hereditary GI cancers. And then we're going to talk with three-time colorectal cancer survivor and Lynch syndrome patient and patient advocate, Dave Dubin. Both of them did an amazing presentation during the annual scientific meeting. You might remember Dave and Heather from previous podcast episodes if you subscribe to the Gastro Girl podcast. If you haven't, please go and subscribe on your favorite podcasting platform and on YouTube. Hey, everybody. We are here live at ACG 2022 in Charlotte, North Carolina at the Charlotte Convention Center. And I'm here with the amazing Heather Hampel, who is Associate Director of the Hereditary Genomics Program at the City of Hope in Los Angeles, California, and the Senior Director of Genetic Services for GIOnDEMAND. And she's done a fabulous job really forging a path for gastroenterology practices nationwide to incorporate genetic testing into their practices. She is a rock star, and we are so happy to have her here today. We're going to talk about genetics, genetic testing, why it's important. So thank you, Heather, so much for being here today.
Thanks for having me. I'm always love to talk to you about cancer genetics.
This is so great. Can you just explain in a nutshell why this is so important, why genetic testing and counseling is important for GI practices?
Yeah, I think, hereditary cancer syndromes are way more common than anybody anticipates. Around 15% of colon cancers are hereditary. And once you find that one person with a hereditary cancer syndrome, it's going to be in half their brothers and sisters, half their sons and daughters. They will have inherited it from mom or dad, which means we've got aunts, uncles, and cousins at risk. And so from that one person that you identify with a hereditary cancer syndrome, there may be a dozen other family members who we can try and keep from getting cancer in the first place. So we want all of our gastroenterologist practices to have the same access to cancer genetics that people do at the major academic centers. And that's what we're doing with GIOnDEMAND.
It makes total sense. And when you came to start working with GIOnDEMAND, you really, forged this path that had never really been in existence before. I mean, and now it's, taking off and people are paying attention. And why is it so important for patients to find out what's going on?
So, for example, the most common inherited cancer syndrome for colon cancer is Lynch syndrome. And that's where I do a lot of my research. So 1 out of every 279 individuals has Lynch syndrome, which is almost 2 million people in the U.S. today.
That's a lot.
We estimate 95% of them are not aware of their diagnosis. But if they knew their diagnosis, they actually need colonoscopies every 1 to 2 years, starting at age 20 to 25. So starting at 40 and going every 5 years, like you typically do when someone's got a first-degree relative with colon cancer, totally wrong for these patients. Not enough, not young enough, not early enough. So we want to help both the practices make sure that they're screening their patients at the right frequency based on their risk level, and these patients keep from getting cancer by getting screened at the right intervals. And so I love that, technology, I think, just finally kind of caught up, and we had this opportunity through GIOnDEMAND to offer really kind of an AI-assisted chatbot scenario for finding these families.
Yeah, the feedback we've been hearing has been super positive. Doctors are identifying patients that are at higher risk that they may have missed without the program. I know there's so many questions I want to ask you, but you're doing a talk this week. What's that about?
Yeah, we're going to give a talk tomorrow, and what we're trying to do is let people know how this works, because we realize that there's a couple key things people want to know. One is, why do this? Well, these are common syndromes, and it helps you figure out the right frequency to screen these patients. So that's a seller. 2, it doesn't cost the practice anything. So we just implement this chatbot, which basically sends a message to their patient a couple weeks before their appointment, branded with their practice's branding. So it looks really like their tool. It asks them some questions about their family history. performs a risk assessment, determines if they're at high risk or not, and if so, asks them, if they're interested in possibly pursuing genetic testing, and kind of gets that enough information to get an informed consent. So then when they pop into the office, the doc can see, okay, this patient's high risk. They want to do testing. They've been through the informed consent. 4 clicks, the test is ordered.
Oh my God. It's super easy.
It's so easy.
There's no reason not to be doing this GI practices.
Yeah,
Get on board.
Absolutely. And it's a kind of a value add for your practice. And so there's 2 ways then that you can either draw their blood, send a tube of blood with the kit, prepaid,
Wow.
or they can give a saliva sample. 2-3 weeks later, you have results. And it could be completely life-changing when we find a hereditary cancer syndrome.
So what happens if you find something that I should know about as a patient?
Great question. So anyone who tests positive is going to get full post-test genetic counseling from someone like me, a trained cancer genetic counselor, who's going to explain everything to the patient. So we're not leaving this for the GI to have to deal with.
That's
we're
so
going to
key.
explain what's going on, explain the risk to their family members, help their family members get genetic testing as well. And, those family members are going to probably end up in the same GI practice getting their colonoscopies. Then we make sure a letter goes back to the gastroenterologist so they can see, okay, this patient has Lynch syndrome. They need to start their colonoscopies at 20 every 1 to 2 years. And so they know what the frequency is then for their management.
This is amazing. I can't believe it hasn't been done already.
It is kind of a surprise. I think, the chatbot technology maybe is the new piece of this. And, it's really the partnership there with Ambry Genetics has been critical because the family history criteria are really complicated. And the NCCN changes them at least once a year, sometimes twice.
NCCN is?
It's the National Comprehensive Cancer Network, and they have a committee that sets up guidelines for who needs cancer genetic counseling and testing. And they have very complex criteria that I don't know how we expect anybody to memorize or know. So the really cool thing about this chatbot and this collaboration between GIOnDEMAND and Ambry is that they keep the criteria up to date at all times. So if a new NCCN guideline came out today and they changed the guideline, and so now anyone with colon cancer met the criteria for genetic counseling and testing, they would change the criteria today. Tomorrow, when somebody fills out their family history, it would be current as of today. And that's a hard part, even for me in genetics, to keep that up to date.
No, it's like fine tuning. So you have less people that you're going to miss.
Exactly.
That's
You're always
so great.
following the current NCCN guidelines. And because of that, the patients, so that people say, well, why are you doing this if the practices aren't paying? How do you make money? The patients are billed for the genetic testing component if they decide to proceed with genetic testing. But because they've been screened to meet criteria, 4 out of 5 owe nothing for the genetic test. 1 out of 5 pays less than $100.
Wow, this is...
She's cracking up about this free genetic testing. I know. People are coming for brochures while we're live
We're just
podcasting.
a popular booth. Heather attracts everyone in her beautiful green dress.
It's eye-catching.
No, this is the beauty of doing things
I
live.
love it. I know that was the second person who's come for a brochure in the middle of our podcast. Maybe we should
give
start handing them
lollipops out.
Just think if we had candy.
I know, it would be. It would be.
We'd have people walking right through.
We would, but this is really serious, and it, as a patient, as a consumer of health, you say it,
Yeah.
I would want to know if something was in my genetics that I could prevent in advance before it erupts into something that, sorry, too late, we can't do anything for you.
I know. I always feel like maybe I'm biased because I work in this area, but this is really a situation where knowledge is power. If you can find out that you're at increased risk for something and do something about it, that's the best prevention, right? I always tell people the best cancer is the one you never get. And that's what I get to do in cancer genetics, try and prevent them in the first place.
I love your job.
It's fun.
This has been great having you on the show. How can GI practices find out about the Ambry and GIOnDEMAND program?
They should absolutely just reach out to us at GIOnDEMAND. We are happy to come and give them a talk about this. Ambry actually does site visits and studies the workflow to make sure that we integrate seamlessly and don't disrupt the workflow. It's really a phenomenal program.
And if you're a patient and if you go to a gastroenterologist, ask your doctor if they're a part of the Ambry Genetic GIOnDEMAND program,
Yeah,
and you want your
please
genetic
do.
test. So thank you so much for joining us, Heather.
You're welcome. Thanks for having me.
Hey everybody, we are back. ACG 2022 Annual Scientific Meeting live from the Charlotte Convention Center in Charlotte, North Carolina. I have been graced by the amazing Dave Dubin, who is not only the founder of Alive and Kicking, an awesome patient advocacy organization, but he is also a Lynch syndrome patient and 3-time cancer survivor. He spoke today at a symposium, GIOnDEMAND and Ambry Genetics, and we are so lucky to grab him here today to kind of just give us the down low on his personal experience, which is amazing, and the importance of genetic testing. Welcome, Dave.
Well, happy to be here.
So happy to see you again.
You're giggling.
Well, how can I not? You just make me smile every time I see you because this is just such a fun, interview.
And we should do it more often.
We should. So, Dave, tell us about your journey, first of all, for those who don't know what Lynch syndrome is and what you've been through.
So Lynch syndrome is the genetic predisposition to certain types of cancers. Typically manifests itself as colorectal cancer, but also gynecological cancers, especially endometrial cancer, obviously in women. It's a very prevalent germline mutation. It is estimated that 1 in 279 Americans has a Lynch mutation. And not only is that a crazy stat unto itself, but it's still also estimated that roughly 95% don't know about it. So if you do the math on that, there's roughly 1 million people walking around the U.S. with the Lynch mutation that don't know about it. And
that's exactly why GIOnDEMAND partnered with Ambry Genetics to bring genetic testing to the GI, the gastroenterology practices nationwide. And I know you spoke today. What was the message that you gave providers? Because that's a huge number of people that are walking around not knowing that they have something that could be prevented.
It is a huge number, and my goal is for others to find out about their Lynch mutation better than I did. I mean, I found out about my mutation. I knew about the whole family history. My father had colon cancer before me, my grandfather. But it wasn't until I was diagnosed not only with colon cancer the first time, but also colon cancer the second time that I finally had genetic testing done. And
so you didn't have testing. You knew that you had a family history and you just kept going about your daily business until you had symptoms and were diagnosed?
Essentially. But we're also talking about 1997. So to put everything into context, I do joke that, Al Gore had not invented the internet yet. So,
That's true.
All right.
That's a good point.
You get my math.
I get your math.
But for this to happen nowadays would be unconscionable.
And that's why we're doing what we're doing. Especially I've seen the amazing things you're doing with the conferences and all your work and advocacy, not only with us, but with your business and your advocacy organization. Why is it so important to get genetic testing?
Genetic testing is information. That's really the best way to put it. And my goal is for not only gastroenterologists, but other types of specialists like OBGYNs, even primary care physicians, to be able to absorb it, to be comfortable with the concept of genetic testing, again, before someone has cancer. That's really what you want to do, because once you have that information, you have your roadmap. I have this with my kids. I have 3 sons. They were each tested after they turned 18. 2 out of the 3 have the mutation. They have the same mutation as me. So, of course, it's another reason for them to be mad at their parents. But, it's part of life. And they know what to expect. They know how to plan for this, and they can be proactive in their care, which is what you want.
Yeah, and that's a great point. So what does that look like when you say proactive in care? Once you find out that you have Lynch syndrome, what does that look like? What does the rest of your life look like? Like, do you have to go under surveillance to colonoscopy, certain time periods? Like, what does that look like for your children now?
Well, it's estimated that, especially let's just talk about the colon cancer side, because we're at a GI conference. From a colon cancer standpoint, it is estimated that you have as much of an 80% chance of developing colon cancer as a lifetime risk. And quite often at a younger age. Again, I was 29. I'm not saying it doesn't mean it's going to be younger each generation, and also doesn't mean you're guaranteed to get colon cancer. I want to be clear on that. No, it's just a very high prevalence. So will my kids start getting their colonoscopies at 18? They are. Will they get screened every year? If their mother has something to say about it, yes, they will. Just like me. That's how it works. You're pretty much at your GI doctor, or in our case, the same GI doctor. He's been treating our entire family, including my brother. I joke that we're recurring revenue, which we are. But this is pretty much the surveillance for the rest of our lives. Until you reach a certain point where you're in your 70s and 80s, hopefully, where it's a little different.
And you're such an inspiration and a role model for, taking what could essentially be seen as bad news, but turning it into a positive because you're constantly on top of it. Your sons are well aware. Your whole family is on board. What are your suggestions for other patients who may be skeptical of, afraid to take a genetic test?
Fear is part of anything, and that's the best way to put it. So it's understandable for people to be afraid of things. It's also understandable for people to push through that. That's really what they need to do. Do I have the magic sentence to get everyone tested for this? No, of course not. But I like to set the example of what you can do with the knowledge, and that's the best way I can put it. I am hoping that a considerable percentage of the population who should get tested does. I'm hopeful that the considerable percentage of the clinicians who should be ordering it for their patients will do so, and it's really the best we can do.
Once the patient has the genetic test, what happens? How do they know what to do next?
Well, depending on, I'm guessing, assuming you test positive.
Right, yes.
So assuming you test positive for the mutation, depending on what that mutation is, because Lynch syndrome is made up as more than just one mutation. I have MLH1, but there are others. So depending on the type of mutation that you have, that'll determine what's going to be your next steps as far as what your screening methodology will be and the frequency. There are some mutations have a much higher prevalence on the colon side. Some have a higher prevalence on the GYN side. It depends. But obviously, there's what should happen after you test positive is you sit down with your genetic counselor and/or your clinician who worked with you, whether it's virtually or in person, and you map out what the plans are, where you're going to go, how often. Obviously, we're hopeful that you're getting genetic testing before you have any sort of symptoms. So, hopefully it's not getting testing because you have cancer, like I had. But it really kind of depends on what your status is as far as that protocol goes. But again, if you do happen to have cancer and then you test positive, that'll determine potentially how you're treated, which is important as well.
Well, that's interesting. Now, tell us a little bit about, you have great resources on your site. You're doing you did some live events. So can you tell us a little bit more about Alive and Kickin' and all the great things that you're doing and how patients can tap into your network?
Sure. So a number of years ago, we started a patient-centric registry. We called it the Heroic Registry, where patients actually are uploading their data and they're indicating their privacy settings. They're going through the whole consenting process as IRB approved. And what has happened because of that is researchers have had the ability to reach out directly with the patients and have conversations about what actually the patients find important, which is different. The recent addition to our programming has been the Living with Lynch program. We felt it very, very strongly to bring a group of Lynch syndrome patients from a variety of backgrounds. Obviously, the male, female, older, younger, a number of different ethnicities, and of course, a number of different mutations and a number of different stages. We have a term called previvor, which is someone who has who has a mutation but has not had cancer yet, and of course, survivors, in some cases, multiple survivors. And we wanted to get that content on camera, share their stories, bring them together with clinicians, have these conversations. And it's really been a game changer. We've been doing it now for 4 years, and we're looking forward to continuing that in the future.
It's so exciting, and I'm so inspired by what you're doing. You have a very difficult role to play, but a very important role. Where can patients access your social media, your website? Give us the info on that.
Everything can be found at aliveandkickin.org, and if you want me to spell it,
Please spell it, because it's not how you think it is.
It is not how you think it is. ALIVEANDKICKN.org. And we're on all the social media, the Instagrams, the Twitter feed, the Facebook, and LinkedIn. But of course, we're on the website. That's where you can get the podcast there. You can also listen to it wherever you get your podcasts, like Spotify and Apple and whatnot.
That's awesome. Any final words for patients or providers?
Be your best advocate. That's really the best way I can put it. it really goes a long way.
Love it. Thank you so much, Dave. I love having you on. I hope we can do this again.
Looking forward to it.
Good job.
Thanks.
Thank you.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.